Hello, and welcome to Bladder Cancer Basics Tips for Caregivers, a video chat with the BCAN carer community. I'd like to go over a couple of housekeeping tips before we begin today's program. All participants are in listen-only mode. If you have any questions for our presenters, please use the Q&A box at the bottom of your screen. Type in your questions as you think of it, and it's best if we can stick specifically to caregiving questions since that's our topic today. We'll be answering as many questions as we can at the end of today's program. This webinar is going to be recorded and we'll make it available along with the transcript later on our website on bcan.org, and we'll send everyone an email about that. So learning that somebody you care about has bladder cancer can feel very overwhelming, and your partner, your family member, or a friend may need you as a caregiver. And we're really happy to have you with us to really talk about some of the things that our carer community really felt were important as we developed these tips for caregivers. I'd like to stop and thank our sponsors for the Tips for Caregivers folder that you should have all received. If you haven't received it yet, we will be sending it to you. It's in the mail. We've been sending them out as you've registered. And that is EMD Serono, PhotoCure, BearGene, and Urogen Pharma. So we appreciate their support in helping us put this packet together. So when you think about it, as you've looked through it, when we looked for important sayings by somebody who was really known to be a carer, I found this wonderful quote by First Lady Rosalind Carter. And it really speaks to this idea that sooner or later, every one of us is going to need a caregiver or going to be a caregiver at some point in our lives. And I think it's really important to recognize that as a person who is caring for somebody with bladder cancer, you're really going to be physical support sometimes, emotional support sometimes, and putting that all together puts a lot of weight on that individual. And, if you think of yourself as an island, as a caregiver, and all the people that you care about are climbing on you for support, it makes it really challenging to, kind of keep your head above water in the sense of making sure that you're staying up to doing everything you need to do to keep yourself sane and keep yourself whole so you can provide care for others. So today in our program, we're going to kind of walk through this new booklet that we have, the BCAN's Tip for Caregivers, with the volunteers that helped us to develop it. We'll talk a little bit about what you can expect as a bladder cancer caregiver and how can you help your loved one during bladder cancer treatment, and then what do you need to do to take care of yourself as well. These are really important things. One of my personal favorite sayings is, joys shared are doubled and burdens shared are halved. So when you look at caregiving, sometimes people think, wow, this is a lot of work to be a caregiver, but there's also a lot of joy involved. And when you're sharing that joy and the triumphs and the little happy things that happen on the bladder cancer journey, it makes it twice as good. And when there are challenges, if you can split that load and share that for somebody else, that does make that burden a little bit easier. I would like to welcome our caregivers who've been very instrumental in helping us develop the tips for caregiver. Mr. John De La Garza, Ms. Wanda Fleming, Ms. Christy Griner, and Ms. Linda Hannon. So I'm going to ask you all to open your microphones, and I'm going to start with John first. If you would just give us a little bit of background, tell us, why are you a bladder cancer caregiver? Give me a fun fact about you. How long have you been doing this caregiving? And why did you want to help BCAN with this project? So we'll start with you, John.
Fun fact, I've graduated from a junior college that no longer exists. Try looking for your records sometime when that happens, when you need things like that. We've been in this little game, my wife and me, I have been since our diagnosis, Labor Day weekend, 2016, coming up. Oh, by golly, next weekend, come to think about it. So we've been in this mode since then, in high gear through her diagnosis, chemotherapy, and radical cystectomy. Higher gear after she went septic in recovery, and that continued for a while. Slowed down at some regularity for a while until earlier this year when some ancillary problems she's still cancer-free when some ancillary problems crept up, and she was in the hospital 3 times in the last 9 weeks. So we are isolated. She was released from home health care yesterday. So we're trying to get back into a regular scheme of caregiving and care receiving, and trying to balance out our life again a little bit with our current situation.
Great. Well, thank you, John. It's nice to have you here. Wanda, would you like to go next?
Sure. I'm Wanda Fleming, and Central Florida is where I'm at. And I'm also a cancer survivor of 45 years. So it was 45 years ago that I had choriocarcinoma. So that is a tidbit about me. A fun fact is I am a Missouri indoor archer champion from way back.
Oh,
My husband and I, of course, have been, it was July 2016 when Dave was diagnosed with stage 2 bladder, muscle invasive bladder cancer. And so our journey began. And it was quite scary, I will tell you that. And then I wanted to, we started our research, and we immediately, of course, we had volunteered at Mayo Hospital in our home in Phoenix for a couple of years. So that was my first place to go to look for something about bladder cancer. I knew nothing about it. And of course, both of us began researching them. Dave actually found BCAN through Inspire. That's where he found it. So we started looking at BCAN and got some really good information there. He had his radical cystostomy on December 2016 after his chemo treatment of Gemzar and cisplatin. He spent 4 days in the hospital, so he was a great patient and came out, and our pathology report came back not what we thought it was going to be. We thought we would be cancer-free, we were not. He has stage 4 metastatic cancer as of today, and it'll be 2 years ago that we found out about it. He took 6 months of Keytruda immunotherapy, and he's doing fine. We're on the wait and watch with these scans every 3 months, and so far so good. Attitude makes a big difference in this journey. It does.
Thank you, Wanda. Thanks. Christy.
I'm Christy Griner. I got my introduction, even though I'm a registered nurse, bladder cancer was not on my radar at all. But my father was diagnosed with non-muscle invasive bladder cancer and had BCG and did well several years before my husband was then diagnosed with muscle invasive bladder cancer. He was stage 2 at the beginning or prior to his surgery. He did go through neoadjuvant chemo, followed by radical cystectomy with neobladder. So we walked through that whole process, and having a neobladder is a process. The training that goes with it and so forth, the maintenance of it initially. Unfortunately, a year after his surgery, he did have some nodules appear on his lungs. And at that point, then we began either standard of care treatments or clinical trials for the metastatic disease. He died just about exactly 3 years after his initial diagnosis. And I think one of the things you had asked us, Stephanie, was how we became interested in working on this project. As a nurse, I worked in patient advocacy. So when I saw that BCAN was advertising for volunteers, I thought, now that would be a good fit with my experience with bladder cancer. It's just a good way to redeem the experiences that I've had and hopefully share something what we learned to help somebody else along their journey.
Well, thank you. And thanks so much for continuing to support Beacon and everything with all the volunteer work that you've done for us, Christy. So this is terrific. Thank you. Welcome. Now, Linda.
Hi there. My name is Linda Hanlon. You can probably tell I'm not from America. I'm from Scotland in the United Kingdom. I'm in Philadelphia just now. My story is a little bit different. My mum was diagnosed with bladder cancer in Scotland 5.5 years ago while I was living here in Philadelphia. She was diagnosed, she was already quite advanced, unfortunately. She was stage 3, probably stage 4, and started chemotherapy maybe a month after she was diagnosed. I was very lucky in that I had a job that was flexible, so I kind of moved between Scotland and Philadelphia with my daughter, my 6-year-old daughter at the time, looking after her. And unfortunately, because her cancer was so advanced, she passed away. It's almost 5 years ago just now. But I kind of feel in a fairly unique position in that I was involved with caring from afar. So if anybody has any questions regarding that, I can help. And I wanted to get involved just because I learned things along the way, and I'd like to do as much as I can to help anybody that's going through this journey.
Thank you so much. And so many people are caring from afar, and it really is hard. You wish you were closer. And, then sometimes there's a family member that might be closer nearby that you want to be able to support and to help. So thank you. I think that is going to help provide some really diverse information about, how you give care from close by and then also from a distance. And one of the things that was really important, we started this whole booklet by really talking about making sure everybody was really well informed about bladder cancer. And so one of the things we decided to do is create a folder, and this is a folder that we have that actually contains a copy of our recent Bladder Cancer Basics booklet, which I think helps to really describe everything that you probably need to know about bladder cancer. And so we really wanted to have this caregiver tip really put together to help support them and not necessarily add more information about bladder cancer when we already had this. So that's why we made this as a folder. And so when you all found out that your loved ones were diagnosed with bladder cancer, where did you go initially? Did you have any experiences you care to share about where you went initially to help learn about the disease? Because for many people, they have no idea that you can get cancer in your bladder until their doctor gives them that diagnosis. And I would imagine that was also true for you as caregivers. For those of you who are medically related, you probably knew a little bit about it. But for those who weren't, is this the first time you ever heard that you could get cancer in your bladder? And where did you go to start looking for information?
Well, obviously, we went to Dr. Google.
Google.
That is after not getting much useful information from a very good urologist my wife has here in Austin and Central Texas. And we developed a little bit of information as she went through the chemotherapy. And we began with the help of a wonderful oncologist also, developed enough information to continue to quiz him until he came out of his shell a bit and started communicating with us as educated adults, if you will. That's a problem with many doctors, I think, that they don't really want to communicate, they want to pontificate. And he was a bit like that, but he's mellowed as our relationship developed. But went through the radical cystectomy surgery sort of hit like a brick. That's when rock really hits hard place. And I think we really got the best instruction we ever had from the WOC nurse at the hospital in San Antonio, where the robotic surgery took place under the,
Yeah, that's the wound and ostomy nurse, right?
correct, wound, yes, wound
Okay.
ostomy nurse. And we were fortunate too. Our surgeon is a BCAN researcher, Rob Spodek. And so we had a bunch of unique ties there, and developed more of a real understanding of what the process was, how the stoma was located, how you care for it, and of course then into my wife's deep dive into septic condition. I became very much a regular daily caregiver in her intensive care rehab hospital situation. I developed where I knew a whole lot more information than their staff did, and was there on a daily basis. So you've got to be inquisitive, you've got to be educated, and you've got to be borderline confrontational in the sense of demanding to know what is going on and to be treated as an adult in the caregiving situation. The more you know, the better you can care.
Well, BCAN, thank you, John, for sharing that, because BCAN's goal has always been a goal of shared decision making, which does involve caregivers, you know, your partners, your adult children of a loved one. These are important decisions that individual who's been diagnosed could use that support. And I always believe that 4 ears hear better than 2. And, you know, when you're shell-shocked with a diagnosis, sometimes you need somebody else who's taking notes, and that's sometimes the role of caregivers. Anybody have anything else to add?
I do. I was a middle school science teacher, so I had my students journaling, and I'm big in journaling. And so I immediately started journaling from day one, and always go in to the doctor with prepared questions. No question is a bad question. So if you want to know the answer, ask the doctor. And like John, we found that our urologist, who is a great person, but they're plumber, as Dave says, they're plumbers. They're technicians, they do their surgery, they fix it, and then they move on. The person that we developed our relationship with was our oncologist. He was fabulous. He released a lot of fears that we had, and were able to answer the questions. Now the oncologist answered our questions, but very much in a clinical way, where that was our urologist, the surgeon, in a very clinical way. He's a great guy. He did very, very good, but it was the oncologist that was the one that when we came back to him again, he said, wow, we're really here again to develop another friendship. And, you know, he's been very, very good. And I'm now on my second journal. I've done in stages. I have kept every appointment. And it's so critical as a caregiver that you write these down, because the patient is hearing, but they're not listening. And a lot of times, Dave and I, when we got home, we would have to go back and review exactly what the doctor said. When is the next appointment? And what's the next step? And so we had all of that to review. And that's, as a caregiver, that really helps your patient. And you've got a clear picture of what lies ahead.
Yeah, true. Christy or Linda, anything else to add before we move on to the next slide?
I just wanted to say, when my mum was diagnosed, I kind of just dived into the internet and read everything I could on the NHS, that's the National Health Service, and Britain's websites, Mayo Clinic, NIH. And even though I have a medical background, I got completely overwhelmed with it all. I didn't know about BCAN. I wish I had. But one thing I did, which was helpful, was all that information I had, I tried to kind of distill it down And like what Wanda was saying, write down questions, the key questions, things that you really want to find out, things that you don't understand. And oftentimes when you have an appointment with your loved one, and you're seeing an oncologist or a surgeon, they're obviously really busy people, and they don't always have as much time as you'd want to spend with you. So if you have your questions right there and listed in order of importance and take notes, that's the best thing I think you can do as a caregiver in an appointment to get the most out of your appointment.
Let me
Thank you.
Let me add that more recently, we've really discovered the degree of care the caregiver and the patient need to give to the notion of all the PCP and the specialists all sharing the same information. It is a difficult job coordinating that information flow with the PCP, the urologist, the urological surgeon is still involved, the oncologist, any other specialists that need to be involved, the infectious disease guy, for example. The information flow, the coordinating of it, the ensuring that all the docs receive the information and read it and consider it. And it's like a woven fabric.
Mm-hmm.
And that's where a caregiver also, I think, needs to give a lot of attention to understanding that all the medical folks have a common set of information and act from it in behalf of the patient.
Yes.
Mm-hmm. Yeah, very often everything is in the medical records, but if they haven't really had a chance to review the complete record, or if they, if you're going in and out of different practices, it's sometimes a bit of a challenge. So I guess you do take on a lot of that role of being the gatekeeper, the note taker in some ways, and the information disperser as necessary, because sometimes I guess, many patients have a lot on their minds anyway, and they may forget some details that perhaps you can help them remember. Anything else, Christy? Did you have anything else to add?
I just am seconding everything they said, but one thing that I did want to emphasize, I think that John said, is just that you are the advocate for your loved one. They may feel too poorly to advocate for themselves. And, it is life and death, and you can't worry about whether obviously you have to be diplomatic, but you can't worry that questioning a doctor's decision or just asking questions is going to offend someone. You need that information, and you have to act in that role for your loved one.
Mm-hmm. Sure. And getting a second opinion is also a good idea. Did any of you, help steer your loved one into a second opinion? Or did they want to get a second opinion as well? Did you guys follow that path at all?
We did not.
No?
We felt pretty
Okay.
secure in the information we were getting and cross-checking between the specialist and the primary care physician involved. We felt very, very confident in what they said, how they came to their conclusions.
Yeah.
Okay.
When our original urologist, when it first came up, and when we got the initial diagnosis of the muscle invasive, my first question was to Dave, do you want to go get a second opinion? And we can go to Mayo. Since we were volunteers at Mayo, we understood their patient care, their doctors, their education, and just so happened that his urologist that was recommended to us with Shands up here at the University of Florida worked under the Mayo. He did his internship with them at the Rochester, Minnesota. So when we researched him, he was the guy we were going to, and he's a great doctor. So we were pleased with that.
Okay. Really good to know. So, you know, sometimes people want to talk to somebody else who's sort of going through the situation. So I did want to just almost do a little brief infomercial, and some of you are volunteers with our Survivor to Survivor program. And for people who are out there and really would like to speak directly to somebody who understands, BCAN does have a core of trained volunteers who offer phone support, and they do know what you're going through. We have caregivers on our list of Survivor to Survivor volunteers. So if you're interested, give a call to 301-215-9099 or email survivor@bcan.org, and we'll help you get a connection so that you do have an opportunity to speak with somebody. Very often, I think what our Survivor to Survivor volunteers do is to explain, hey, when I was going through this, I wish I had asked this question or that question along the way. So I think that that's also very helpful. And, you know,